What does mental health in the postnatal period look like? What does the immediate postpartum period look like? Whether someone is breastfeeding or bottle feeding or a mixture of both, breast milk is recommended, but for many reasons, parents might choose to or not be able to breastfeed. Either way, if you have a look at the stomach capacities of a newborn, you can see why they need feeding very frequently. It can be anywhere between 6 and 12 times a day, so about every 2 to 4 hours. Newborns do sleep up to 18 hours per day. However, that's usually in stints of around 45 minutes to maybe a couple of hours at a time. If you haven't had children or been around newborns, you are getting up around every 2 to 3 hours during that time, sometimes more frequently. During that time, you need to feed them, change them, burp them, resettle them to sleep. Then after you fall asleep, you might be getting some bits of maybe an hour at a time. So thinking about how that might impact someone's moods, their energy levels, their ability to function safely, let alone thinking about trying to get back into a regular exercise routine. The baby blues is a really common issue that happens usually a couple of days after birth. You do get some depressive symptoms like sadness, irritability, insomnia, exhaustion, issues with concentration. Usually peaks around 2 to 3 days after birth, and it should have largely resolved by around 2 to 3 weeks. We know probably the vast majority of new birthing parents will experience this. This should be reasonably mild and self-limiting. Depression itself is unfortunately reasonably common, and at least 1 in 10 new parents will experience this. We know that it can occur before birth, and for those that with an onset of depression after birth, it will usually be in the first few months. Risk factors include having a previous depression, like before or after pregnancy, high levels of stress, being young, having multiple births like twins or triplets, poor physical health, and difficulty breastfeeding. Symptoms are very similar to a major depressive episode outside of pregnancy. So feeling sad, irritable, anhedonia, which is that loss of joy or pleasure in previously enjoyable activities, feeling guilty, hopeless, fatigue, loss of energy, sleep disturbances. And by that, I'll usually ask, when the baby is sleeping, can the parents sleep? Are they waking for any reasons other than baby? Also some anxiety about the health of the infant, or worrying that they're not able to adequately care for the baby. Outcomes this might resolve, but it can develop into a chronic depressive disorder, and the duration for most people will be at least a year, and then keeping in mind that they need to still look after this newborn during that time as well. There is a risk of recurrence. Untreated, there is a risk of early cessation of breastfeeding, and there are some significant potential impacts on the infant. For example, safe sleep practices, getting to medical appointments, social development, and not forgetting, of course, that suicide is a leading cause of death in the postpartum period. What can we do about it? Medication-wise, there are very safe options for during pregnancy and during breastfeeding that we can access. And we'll always weigh up the potential effects of an untreated mental health condition on mum and baby versus any potential side effects. Psychology is also great, and of course our personnel can access that, and social support. Who is around to hold the baby while the birthing parent has a meal or has a shower, has a sleep? Can someone bring prepared meals? Can someone help with cleaning? Anxiety is much more common in the postpartum periods than in the general population. Depression is quite commonly screened for postpartum, but anxiety is not. Risk factors would be a previous anxiety disorder and lack of support, so like whānau social support. Symptoms can be similar to depression, but also think about things like restlessness and excessive worry around baby's well-being. And feeling unable to care for the baby. Can also get some physical symptoms like palpitations or your heart racing. This can, of course, lead to a chronic anxiety disorder and can impact on a child's emotional development. Treatment options are very similar to the previous slide in terms of the depression. Other things, don't forget about PTSD, post-traumatic stress disorder. Births can be incredibly traumatic. Postpartum OCD can occur in around 3 to 5%, and even postpartum psychosis can occur in up to 1 in 100. So what can you do? You can listen, you can try to understand, you can give some positive words of support, you can refer to medical, to their midwife, to any of these supporting agencies. Huge importance on not judging, particularly on the type of feeding that people are doing. Chat to friends that have had children, what helped them the most. What support does the parent have? Do they have a partner? Do they have whānau around? What support can they access? We know our personnel can get access to medical, they can get psychology, they can get medication, we can access feeding and sleeping advice. We can often just be a listening ear for them. The base support team, welfare meals. There is a Plunket 24/7 line, which is very helpful. There's Mothers Helpers. Little Miracles Trust is for preemies. Bellyful are volunteer organisations who drop off free meals for new parents.